Welcome back to part 2. We are now getting ready to administer the patient antibiotics. Since I brought everything in the room, I'm not having to worry about regloving or anything like that, or re-identifying the patient. If I had left the room, I would do that. So we're going to go ahead and administer Clafuran 560 milligrams to the patient. She's going to be receiving an IV piggyback every 8 hours. This medication has been reconstituted into 500 cc's. So based on my calculation and reviewing my MAR, it's going to be 1.12 milliliters. And the order states that we need to draw this medication and inject it into a 50 ml normal saline bag, which I have here, and I have it labeled right here with the patient's name, date, the time begun, which was 9:15, and the estimated completion, which is 10 o'clock, since it's to be infused over 45 minutes. And I'm going to go ahead and take an alcohol prep. I'm going to clean the top of the bottle. I'm also going to clean the, I'm going to clean the top of the bottle, and then I'm going to get the bag, pull off the little cap that was on there, and I'm going to clean that. Now that we're all ready, I'm going to go ahead and open my syringe. I'm going to take the cap off of it. I'm going to pull back 1.12 of air, and I'm going to go ahead and inject that air into the bottle. And then I'm going to withdraw 1.12 mLs, which is 560 milligrams of Clafuran. Okay. Now I'm going to inject it into the hub of the little bag. Get rid of my sharp. And I would mix it by like kind of gently rolling it around in my hand. And then I'm going to go ahead and hang this, but what I would like to do is drop this down to hang lower than the actual IV antibiotic, so that by gravity drainage, the medication is going to go in first. So we have our med label on. Oh my God, what am I doing? Why is it not my voice? Okay, and then I'm going to go ahead and get my IV tubing, make sure that my roller clamp is down. I'm going to take the cap off. I'm going to spike the bag. Okay, so I would spike the bag, but for some reason it doesn't fit, and I don't know why. Maybe there's...
Is it the other one?
Maybe I didn't, maybe that is more of the cap. That's not more of the cap. Okay, so I hooked it up. And we only have 10 drop tubing, so I don't know if that is playing a role here, but then I'm going to go ahead and open this up. I'm going to use another alcohol prep, and I'm going to clean this port before I connect it. I'm going to go ahead and connect it. I did already run the air out and everything prior to, and then I'm going to go ahead and open it up. It's going to set to run over a total of 45 minutes. So we're going to do 66.7 milliliters per hour, but I do recognize it's only 50 mLs, but it's going to end up being 11 drops. And this is the only IV tubing that I had, so I'm not able to actually calculate the drops. But if I did, I would open up to where it was giving 11 drops. So we're going to pretend that that has now infused, and we're going to go ahead and put the, it'll be closed off, and we're going to rehang the IV bag, the second bag, for another 1,000 mLs.